Hello, my name is Alia Nascimento, and I'm going to talk about the distrust that the Black community has in medical professionals. And this all began, of course, with slavery, where Black people were treated as less than and put through all of these trials without any kind of consideration for their well being. And this continued on through Jim Crow, where we have cases such as the HeLa cells, where Henrietta's cervical cells were taken without her consent and are still being used to this day. There's cases such as the Tuskegee syphilis trials, where a group of Black men were given syphilis and were not provided with any proper treatment, with considering the fact that there was penicillin already available, which is an effective treatment for syphilis. This was highly unethical, and it continues on with all of these different stories and cases that you hear throughout history. And the most shocking fact is that to this day, Black women are 3 to 4 times more likely to die during childbirth. And this is incredibly unacceptable because it is 2022. Why is things such as this still happening? Why is there still such a gap between Black women and white women? And this all boils down to medical distress and doctors not paying attention to the complaints of Black women. There are multiple cases where a Black woman will complain of certain pain and discomfort, and they will not be taken seriously simply because of a bias that states that Black women or Black people have a higher pain tolerance, which is ridiculous and what leads to a lot of medical distress in a community that is already less likely to seek out medical help, specifically Black women, where they feel as if they are the caregivers. They need to take care of everybody else, not the other way around. And this leads to diseases progressing to a point where whenever they are caught, they're less likely to be able to survive or sustain treatment and or have a higher death rate in cancers, strokes, heart attacks. All of that are problems that affect the Black community and are problems that could have been caught earlier on had there been more trust in between the medical field and Black community. As healthcare professionals, doctors and nurses and any healthcare professional needs to create a bond with these people so that they feel like they're in a safe space, and they need to be able to educate themselves on all the unconditional biases that they may have so that they are able to better take care of their patients. And as a future healthcare professional, I sincerely hope to be able to do that. I want to keep educating myself so that I'm able to treat my patients with equality and be able to be that doctor where my patient won't hesitate to tell me about their symptoms and everything that they're feeling. And I hope to one day be able to achieve that. And my master's program in biochemistry and molecular biology is just the beginning.